Hi, this is Dr. Tasman Cordy, and we're going to talk about fibromyalgia today. Fibromyalgia is a syndrome that patients who are usually between the ages of 20 and 55 have. They're often women, about a 10-to-1 ratio between women to men with this syndrome. And usually they start finding that they have symptoms of fibromyalgia after a big event, a big psychological, emotional, or physically traumatic event like a car accident, or their child goes away to college, or there's a death in the family. Something significant that meant a lot to them happens and is traumatic enough for symptoms to start after that. It's an interesting condition because it's a central nervous system problem. It's not a peripheral nervous system problem. So what that means is the central nervous system doesn't process pain properly. So normally when we push on muscles in a person on their arm or their leg, or the front of their body or the back of their body, it doesn't hurt, it just feels like pressure. But patients with fibromyalgia have pain with that pressure. And it's abnormally responsive to the pressure in that it hurts them. Unlike it really should. It's significantly more stressful or traumatic for those points to be pressed, and we call those points tender points on fibromyalgia patients. They're not trigger points, and they're not a sign that something traumatic has happened in that particular tissue, because it's a problem, again, at the central nervous system. So abnormal pressure all over the body globally causes a pain response that's completely abnormal to what we would expect when we put pressure or stimuli on someone's soft tissues. Lots of these fibromyalgia patients also have irritable bowel syndrome. They have depression. They're fatigued, and chronic fatigue syndrome is a common syndrome that goes along with fibromyalgia patients. It's not always the same thing. It's sometimes a bit different, but it definitely can be part of their whole syndrome. And they also have brain fog. Now, what we do in our office to start helping these patients is, first of all, we do some food sensitivity testing. We want to make sure that the foods you're eating you aren't sensitive to. And sensitivity is different than allergies. So food allergies are something that you eat something like fish, or you eat nuts, or you eat eggs, and you have a big response and you feel terrible. And you need maybe an EpiPen, or you need Benadryl right away, because otherwise you get remarkably worse. You might end up in the emergency room. That is not what we're talking about here. We're talking about food sensitivities or intolerances. And food intolerances or sensitivities are something that you eat something maybe today, and 2, 3, 4, 5 days later, you have some kind of abnormal response. So maybe you get a skin reaction, maybe you get a rash, maybe you get digestive upset. Even if it's 4 or 5 days later, that food is long since out of you, but something happens that causes problems. And that's why we look at sensitivities. They're very hard to detect without doing blood testing. The second thing we look at is nutrient deficiencies, because we know that if you have a pain syndrome like fibromyalgia, you are deficient in some kinds of nutrients, and we need to know what those are so we can replace those properly. And the third thing we're going to look at is your exosome, or the toxicities you're getting from your environment. So that might be your air quality environment, that might be your food quality environment, that might be your emotional quality environment. So we're going to take a look at all of those things and wholly put a picture together for you, and we can develop then individualized or customized plans so we know what foods you're sensitive to, what nutrients you're deficient in, and what things in your environment are creating or causing worse problems for you, because fibromyalgia patients do not detox well. They can't clean things out of their system well, and so the less things we put into you that are suppressive or that are damaging or toxic for you, the better off you're going to be. But we need to figure out what those are. We need to remove them, and then we need to give you extra support so you can clean your system out as well as possible. So that's where we're going to start with this, and then we're going to start getting you better over time, and it certainly does take time because this did not happen overnight. So give us a call at 732-852-7752, and we'll get you in for a free consultation, get you started getting better, and figure out where your fibromyalgia is coming from. Have a great rest of your day. Thanks.